Oh, we've got some Obamacare hiccups to tell you about. 3 states in big trouble. 47 to go at this rate. Maryland and Oregon and Massachusetts all facing problems with their state exchanges. And all our front and center focus tonight. Here to do the honors, we've got my buddy Tucker Carlson. We were just calling him brilliant earlier at a staff meeting, so he has very, very high hopes to live up to. I want to bring my panelists here as well, who will be our superstars tonight. We got Simonetti, we got Todd Schoenberger, and Jessie Duff. All right, so Tucker, the latest read that we're getting is that, and going through this, Oregon is ditching its state exchange to join a federal exchange. Millions of dollars of missing funds. FBI looking into it. Maryland is eager to get more money from Washington to get its exchange going. But even Washington, this is the Obamacare folks themselves, are saying, we're not sure you're good for it. And now, of course, Massachusetts, the way the media is portraying it with some of these headlines, it's Romney care troubles, not Obamacare problems, but nevertheless, it completes a trifecta. What do you make of it?
Well, it's not just Maryland that wants more federal money. I mean, that is the thing that undergirds all of these, is all of them are looking for money from the feds, and they're all going to get it. And by the way, so is the insurance industry. I would say of the 3, the most amazing is Oregon. There is apparently an FBI investigation. The FBI never confirms it, and won't in this case, but apparently there is. They spent $130 million on their website since March. They have signed up not a single person.
And is that right?
Right. Not one human being.
That's not good.
It's unbelievable.
No, I'm the math expert.
Well, there is a line that crosses from incompetence to criminal behavior, and that's what the FBI is looking at. But really, you just have to go back. I know it's hard to remember this. The whole point of this program, Obamacare, was to help a relatively small percentage, a tiny percentage, really, of Americans who were persistently uninsured.
But we've upended everything for this group.
On their behalf, we caused all this chaos.
And many of them don't even want it or have trouble signing up for it. So, Lauren, we're going to mix and match with our esteemed colleagues here. What does this mean now? Because there are, I noticed Nevada's having problems, Georgia's having problems, especially with paying enrollees. Alabama, I could go on and on and on.
I looked at 4 states that are spoken about a lot. They're Maryland, Minnesota, Oregon, and Massachusetts, the blueprint for Obamacare. They're all in trouble, having huge problems with the exchanges, many going to the federal exchanges. All of them have Democratic governors. Isn't that interesting? Only 2 are up for re-election. So I think the political implications of this might be, will those blue states get a Republican in there?
The one thing that struck me, Jessie Duff, is early on, not in all media coverage, but the coverage that I've read in Massachusetts, you would think it was a Romney care debacle, that it was the fault of then Governor Mitt Romney's experiment to provide health care for ultimately 97% of that state's residents that got torpedoed here. And that prompted a lot of, chest thumping and clarification on the part of a key advisor to the then governor and former presidential candidate. What we've seen is the dismantling of a once popular and effective system to be replaced with a widely ineffective and broken one. What do you make of that?
It's too big to fail. So now Massachusetts is stuck with 2 choices. Spend more money on a program that's had limited success, or transfer everybody over to the federal exchange. So this is like trying to decide to marry the devil with the short red dress on or the devil with the low-cut blue dress. Both are bad decisions.
This is a family show, just so you know. I don't know what you watch.
But this will tempt you into making a bad decision.
Up here. But here's what I worry about, Todd, and what this might portend, especially in the case of the Massachusetts. I found it very interesting that the press immediately glommed on to Massachusetts. So that's Romney care. It wasn't Obamacare, it was Romney care. Not in all stories. We showed you a smattering of the headlines. But the big ones that I saw, and Tucker reads a lot more, so he'll correct me, but I just found it interesting that a state that had some big problems, no, it's not on the president. It's on the guy who wanted to be president. What do you make of that?
Yeah, and I think you're going to have a lot of that kind of finger pointing too, Neil. A couple of things here. We shouldn't be surprised by any of this. I mean, the way that this was put together, it wasn't put together the right way, and you have to start looking at the regulatory environment. You will have a lot of people that are looking at fraud, possible criminal activity, but the bottom line is, though, it may not matter, because that headline story, the story about how many people have signed up, that's what the White House is going to focus on, especially going into midterms. The Democrats that are still there, they're still looking
they have signed up. Tucker doesn't have to get back to how many are net new, how many are paying.
Oh, totally.
And these 8 million figures that you're given, they're way, way off.
Probably closer to 5. We don't know. We could know tomorrow. The White House has access to those data but hasn't released them because they're embarrassing.
They always release the data that's friendly to them. That
well, of course they do, and they have it right at their fingertips because they're numbers people.
But we focus on that number, guys. That's what you and I, that's what we will focus on. Main Street America and Middle America, they look at that headline number, and that's going to be the key number that we need to focus on.
What do you mean by the headline number? The overall number or the
over
net
8
clear
million.
paying
Every time President Obama goes out to the Rose Garden to talk about how many people have signed up, whether they paid for it or not, is really that we know that that's a relevant point. We look at the business part of this and how much money has been spent on these exchanges. But you're saying that most Americans
do not. They're hearing that? Or
that's how I look at it. Look at the jobs number.
The headline, and you've seen it in the general press coverage, they don't go beyond that a lot of times.
Well, yeah, because it's not verifiable. I mean, that's the point. We know from a couple of states, we extrapolate from that what the national numbers might be. We know for a couple of states that a relatively large percentage of these people haven't paid, but we don't know the national number, so 8 million stands. I mean, it is the triumph of public relations over everything. I would just say, Lauren's point, I think, is smart.
He keeps looking at my notes.
You just made the point.
You have a lot of notes.
The governors, you've got two governors.
Prepared for this, like Warren.
You should see it. You've got.
But she kept saying, like, I hate Neil, I hate Neil, I hate Neil.
That's on me, too.
Okay, there's some filthy stuff on there.
Yeah, really.
Deval Patrick in Massachusetts and Martin O'Malley in Maryland were both mentioned as presidential contenders, and now they're not. Now they're not. It's going to be very tough for those guys because of.
But they call it, Lauren, growing pains. That the president said, some bumpy adjustments and all this. Look, what do you make of that?
When you do a deadline that's so black and white, and we're talking about getting these websites up and running, which is tech spending, no IT company out there makes a deadline that is crazy.
Isn't the Oregon one
it's a self-imposed deadline.
They're throwing out Oracle. They're saying it's Oracle's fault.
One of them is Oracle, and Oracle's in trouble. Absolutely, I can't remember which state.
All right. Jessie, where does this go then? What does this mean? I mean, obviously more states are going to come along and we're going to see more problems. These are growing pains. We're certainly getting enough of them.
Growing. It looks like we've stunted our growth here. Al Capone is running all of this. They're taking the money from the federal government.
Now, why
and
do you have to drag
programs.
my people into this? I mean,
okay, but they're spending in Massachusetts. They put 190,000 people on Medicaid at the cost of $10 million a month. So what is going on here when we're spending more money? And they had to do paper applications because their $57 million website couldn't get people registered. This is paper applications. We're talking 1914, not 2014.
But Tucker, real quick, a final thought on this. The argument is that by November, even these hiccups, substantial delays, state exchange problems, will be a distant memory in some 6 months.
Name a single person out of 315 million who really understands Obamacare. You can't, because there isn't one. It's too complicated a system. Even the genius Lauren doesn't. We're going to wind up with just changing the eligibility for Medicare and Medicaid, and that's going to be the solution. We're all going to be on it.
Thank you, my friend.
Exactly.
All right.